everyone, this is Christina from Sweet Pea Births. Today is International Day of the Midwife, so I want to start off by wishing all the midwives out there happy International Day of the Midwife. We are grateful for all that you do. And I thought I'd take today just to highlight what it is that midwives do, where they practice, and why you might want to choose midwifery care. So a midwife is a trained professional that is trained in low risk, normal, healthy birth. They can also be trained to they're trained to work in hospitals, in birth centers, and also some choose to work at home. So in the home setting, you have what's called a certified professional midwife. There's several years of study. They have to attend a certain number of births, and there's it's a Midwives Alliance of North America. It's actually an international in Canada and United States certifying board that tests the midwives and makes sure that they are ready to enter care in the home setting before they take any clients on an individual basis. Then on the hospital side, there's certified nurse midwives called CNMs, and they are RNs who have had an extra course of study to get their master's in nurse midwifery, and so they are trained not only in the basics of midwifery care, but also in the administration of drugs, and also on, you can also have your midwife, should your birth be turning the corner, is no longer normal, healthy, low risk, they can also attend your cesarean. So they can be right with you should you need a cesarean birth instead of a vaginal birth for your baby. So why would somebody want to choose midwifery care? If you're interested in evidence-based, family-centered, really woman-centered care, midwives practice whether you have a baby at home, the birth center, or in the hospital. Midwives have this theory that birth is normal and well, and they practice what's called watchful waiting. They don't get involved unless they feel like the birth is getting out of the risk of, or the level of normal, low risk birth. And then that's when they put their skills to bear to help moms either preserve the vaginal birth that they want, or like I said, in a hospital setting, they can help moms by being with them through the cesarean birth experience. So we really encourage you to take a look at what midwives do. We loved having a midwife for our fourth child. We had her here at home, and when we realized what a difference there was between traditional obstetrical care and midwifery care, it really made us wish we had transferred care a lot sooner in our birthing journeys. Our midwives took an hour every prenatal visit, from the first one to the last one when I was 38 weeks, 39 weeks. They were right there with us whether it was every month or we got every 6 weeks to every 4 weeks. They were right there getting to know us, getting to know Bruce and I, getting to know our children, involving our children in the prenatal care, and visiting us here at home, making sure the home setting was ready and safe to welcome the baby. Complete opposite from the traditional obstetrical care that you get. You get an hour in the waiting room, the nurse takes your vitals, and then you get maybe 5 to 10 minutes with your OB before they dash off to the next number or room number, the next patient of the day. So I know that the hospital-based midwives also take the time to get to know their clients, whether it's a 30-minute appointment or an hour appointment. They always take the time to really make sure they know their patients as people, not just as room numbers. So I wanted to, again, take another moment to just say thank you to the amazing midwives, both the certified nurse midwives and certified professional midwives that serve birthing families out in the area. I want to encourage you to take a look in the comments. There is a difference. One of the biggest questions is, what's the difference between a midwife and a doula? I'm going to link some blog posts there for you so you can know the difference, but there is, midwives are trained in birth, where doulas are trained in labor support. It's two completely different spheres of practice. So even if you're having a midwife at your birth, if you really think you want emotional support, you'd want to look at a doula, but that's not the point of today's message. Again, it's really just to bring awareness to what midwives do and say thank you for the incredible work that they do in the community. So happy International Day of the Midwife. We'll see you next week.